Imagine this. Your 80-year-old grandfather, a vulnerable asthmatic, is experiencing slight shortness of breath and needs medical attention. Yet, the hospital is busy and he brushes it off, believing beds should be reserved for COVID-19 patients. Days pass and his condition worsens. When we think about the effects of COVID-19 on our community, no matter where we live, we must think about the performance of the system as a whole. Specifically, let's examine the lack of hospital beds for both those diagnosed with COVID-19 as well as other patients. Alternative spaces provide one solution. Can we improve them? 1 in 6 patients currently using a hospital bed is stable and suitable to head home, yet cannot, due to a lack of transportation. Now, let's go beyond the internal care space and try to streamline the patient's journey from start to finish. Efficient transportation is key to an efficient system and faster access to available beds for patients in greater need. We are the Four Bros. My name is Haley Liu, and with me are Alexa Kalkoven, Owen Klassen, and O. Jasby Pant.
As infection rates rise, hundreds of patients are predicted to be discharged from care per day. Some of these patients might not have loved ones to pick them up or the money to spare for a cab. These issues are worsened when we consider alternate care facilities, as they may be unfamiliar and hard to access. This raises the question, how can we better get these patients home and make space for new patients? All over the world, we are facing an economic crisis. One industry hit particularly hard by the virus is public transit. In fact, some cities have seen up to an 85% decline in public transit use. With the earlier question in mind, we talked to Calgary Public Transit employees and discovered how transit resources can be redirected to solve our problem.
Our solution is to use the pre-existing public transit infrastructure to shuttle patients home, speeding the rate at which alternate care facilities can discharge patients. When patients are ready to be discharged, Alberta Health Services will determine everyone's destination and map out all the necessary stops for the Calgary Transit vehicle, along with the number of patients expected to get off at each stop. It will be safe. We will continue using safety measures Calgary Transit already has, like marking seats to enforce social distancing, limiting the number of passengers, and regularly disinfecting high-touch surfaces. And it will be secure. Only AHS will have access to identifying information to protect passengers' privacy, and it will be informative. We plan on adding government-approved posters and guidelines to give passengers the latest information on post-COVID-19 care.
In terms of cost, we would start off with 4 repurposed buses, one for each corner of the city, taking a maximum of 20 people per ride. In order to staff them, we will reassign drivers from underused routes and assign them to alternative care facilities. The drivers will be paid by the government through economic stimulus funds, keeping transit workers employed through this hard time. As well, collaboration with AHS can provide extra PPE and sanitization equipment to further ensure the driver and passenger safety. Looking forward, we plan to extend the solution to get workers to and from the facilities, also incorporating non-Calgary transit options such as school buses for more vehicle resources. As well, we hope to expand the concept to mobile testing and transportation of equipment between facilities. By implementing our plan and increasing patient turnover, more COVID patients will receive service from alternative care facilities, leaving more room for not only other COVID patients, but also the unseen victims of the virus who are held back from regular hospital visits and care. This battle isn't just up to us. We must work together and embrace innovation to help our community become stronger.